Assist by Mark Walters, USA Today Network. Open quote. This article mentions suicide. If you've experienced thoughts of suicide, confidential help is available for free through the Suicide and Crisis Lifeline by calling 988 in the United States. You can find more information at 988lifeline.org. Additional resources can be found at Mental Health America. Close quote. Gov. Josh Shapiro touted new funding for mental health programs in Pennsylvania's budget as a major achievement, including the $15 million boost among his administration's 18 budget wins. The state's budget allocated $10 million for the 988 Crisis Hotline, which serves as a lifeline geared towards suicide prevention and helping callers in need access critical treatment services. There were 1,845 deaths by suicide in 2024 in Pennsylvania, according to USA Facts. That is down from 1,955 in 2022. In 2025, the state's 14 crisis call centers handled more than 145,000 calls. Another $5 million goes to the state's emergency behavioral health walk-in centers, which offer immediate and specialized care for anyone experiencing a mental health crisis. Like 988, the centers are designed to prevent people in crisis from going to emergency rooms or jail, according to officials with the state's Department of Human Services. See Mental Health, page 2A. Page 2A, Mental Health continued from page 1A. The department licenses 82 of these facilities across the state. They are operated by counties or private providers. Medical staff are available around the clock, so individuals can be prescribed medication if necessary. Barriers to access. In some cases, someone in crisis could have to drive an hour or more to access a walk-in center. If split evenly across all 82 ways, the allocation would give each facility almost $61,000. Open quote. It's an expensive service. Miki Drutchall, administrator for the Lackawanna-Susquehanna County's behavioral health programs, told USA Today Network, Pennsylvania. It's a vital service. We're just not able to make some of these ends meet. Close quote. County Human Services agencies, along with service providers, are essentially on-the-ground operations dealing with Pennsylvania's mental health needs. Counties receive millions in state and federal funding each year to meet demand. Federal cuts to Medicaid and Medicare are estimated to result in hundreds of thousands of Pennsylvanians losing their plans by 2027, leaving vulnerable people who rely on critical care services uninsured. Open quote, we're the people who will pick that up, especially people in crisis, Drutchell said. It's counties that will see those impacts. Close quote. How much money is enough? The additional funding in the 2026-27 budget is meant to help mental health patients across the state, and it will, Drutchell acknowledged. Across the board, state funding for mental health programs and services increased $41.2 million since last year, bringing the total allocation to $99.8 million. That includes investments in school programs. The $15 million boost is not nothing, although it is marginal considering the public need for treatment and services. Open quote, we're already having conversations with providers, Drutchell said. We can't do any kind of increases. We're stagnated. Their costs are increasing. Personnel, insurance costs, benefit costs are all going up. Our revenue is not. Close quote. In Shapiro's first year as governor, 2023, the administration launched the Behavioral Health Council, so state and local leaders, along with providers, could develop a statewide action plan to address mental health challenges. Open quote, council members will develop specific recommendations to decrease the wait time for care or services for individuals with mental health illness or substance use disorder, according to the release that included quotes from officials across several state agencies. Thus, close quote, since 2023, nearly 800 schools have expanded mental health services and support for students. The new budget also includes an additional $12 million for rape crisis centers around the state, what Shapiro's administration called the largest increase in Pennsylvania history. It brings the total allocation for the centers to $24.2 million. Photo caption. Desiree Arney is executive director of the Reach Out Foundation of Bucks County, which offers peer support groups for those struggling with mental illness and drug addiction, as well as providing shelter during code blue alerts. Baldwin, An administrator for the county's mental health services told USA Today Network Pennsylvania that the Western Pennsylvania county now gets around $11 million. Open quote, "Is mental health better than it was in the 70s?" Baldwin posed. He acknowledged the semantics and societal changes surrounding his inquiry. Is money going to answer our problem? Close quote. Baldwin pointed to social media, which he said gets into kids' hands when they are too young. He supported the state's cell phone ban in schools, which he said is a good start. Extra money in his agency's budget could make a difference, Baldwin said. It can create more programs and enhance services. But the future of mental health is more of a people issue than a funding one, he maintained. Baldwin pointed to the nationwide peer support group Alcoholics Anonymous as an example of how merely connecting with a